Okay, I am back for my urinary catheter removal. Mrs. Roan, she would then allow me to come in. I will close off the area, shut the door, the curtain for any privacy. Okay, Mrs. Roan, I'm here to do your urinary catheter removal per the request of my physician. Do you have any questions for me? Did you experience any discomfort or any itching, swelling, or redness that you noticed while the catheter was in? Good. Any painful urination? Okay, I just want to reassess to make sure you don't have any allergies, and no allergies to the equipment that I'll be using today, latex or anything. Good. Okay, before we begin, I will then lower the bedside rails, place my patient in the supine position, legs up once again to expose the genitalia, so I'll be able to see the area to make sure there weren't any reactions to the catheter, no redness, swelling, or irritation, no any rashes. I will raise back, perform hand hygiene. As I came in, I will also be donning gloves. I will roll back my patient's gown and blankets. We already have a blanket in place. I've already set a blanket in place, something to catch any drainage or anything. I would assess the area for any kinks within the catheter, make sure that everything emptied into the bag properly. Everything seems to have emptied into the bag properly. I would then don clean gloves. Take some gloves out. Gotcha. Sorry. Using the same gloves for my assessment. Only came with so many pairs within the kit. Okay, Mrs. Roan, just setting up for the removal of the catheter. If you have any questions, just let me know. I have my specimen tube. I will empty the remaining liquid from the catheter bag into the specimen tube. I will have my specimen. I will then use my label to write the name, room number, doctor, time of instructions onto the specimen. We will then send this off to the lab. I will put that into the box to be sent off to the lab. I will be using a syringe again to deflate my balloon. Okay, Mrs. Roan, this shouldn't take long. I'll be deflating your balloon today to remove the catheter. Is that okay? We've already emptied all the contents of the urinary bag into the sample cup. We've already lowered your bed, put your legs up, made you comfortable. I'll be removing the Velcro strap or any tie that was used to wrap this around the leg and connect it to the thigh. I will then attach back my syringe to the same area that I used to inflate the syringe. I will pull out, assessing that the urinary catheter has deflated. Okay, you may feel some pressure as I'm removing it, but it shouldn't be too uncomfortable for you. Gotcha. I have now removed the urinary catheter. I will dispose of all the contents into the trash bin. I will remove my clean gloves. I will perform hand hygiene. Gotcha. Now that I performed the hand hygiene, I will also be putting back down your gown, pulling back up your bed linen, that my hands are clean. I'll pick up back up your side rails. I'll make sure that you have your call button so you can call me with any concerns. I've assessed the genitalia. You didn't have any redness, wounds, any rashes or anything. When I removed the catheter, everything seems to be intact. Do you have any more questions for me? Okay, well, Mrs. Roan, thank you for being such a good patient, and that's the end of our urinary catheter removal and insertion. Now I'll perform hand hygiene again, and I'll exit the room.